Asian Roundtable on Social Protection, Rethinking of Social Protection in Southeast Asia Countries, Challenge of COVID-19 Crisis, and the Way Toward Transformation Social Protection. Okay. To participants, let me share a quick guidance how to use key function of Zoom in this webinar. To mute and unmute, start and stop video, to choose your language channels. On the right channels, there's Khmer, Indonesian, Thailand, and also Vietnamese. You can drop your question to the moderator or speakers in chat box or raise your hand and co-host can let you in and start to speaking and asking your question. If there are any problem during the webinar, you should contact to co-host 5 privately on chat box. Okay, I will invite Mr. Anwar Sastromaru from KPRI to opening remark. Mr. Anwar Sastromaru, time is yours.
Okay, thank you, Pungki. Thank you for organizer. Good afternoon, everyone. Assalamualaikum warahmatullahi wabarakatuh. I am Anwar Sastromaru from KPRI, Confederation of Indonesian People Movement. Thank you for joining in our webinar series. Rethinking of Social Protection in Southeast Asia Countries, Challenge of COVID-19 Crisis, and the Way Toward Transformative Social Protection. This webinar series organized by CDI from Vietnam, KPRI from Indonesia, and IMRC from Hong Kong. And this day is a short webinar with topic toward transformative social protection in Southeast Asia, rethinking upon COVID-19 pandemic. Related with our topic of our discussion, we are currently face to face the crisis caused by the COVID-19 pandemic and the climate crisis and the radical change in digitalization or revolution 4.0. We are experiencing a health crisis and economic crisis impacting job and income and human survival and ecological crisis. I am reminded of our workshop for social protection 10 years ago that drew together various people, organizations from the various sector, workers, peasant, fisherfolk, women, indigenous people, and urban poor. And we found the key word of the transformative social protection is the life cycle of human and the universe. I think this is very important. And now we have of the new condition, is very bad condition. Meanwhile, our problem, the people who are dissatisfied with the government performance in implementing social protection policies and the applicable social protection have not implemented the social protection principle such as universal, democratic, transparent, and so on. Today, we have a momentum. COVID-19 has given us the opportunity to look for creative and innovative alternative social protection strategies that are inclusive and participatory by enabling the public to directly involve. Of course, there are still many shortcomings. So now we have lure to deeply discussion with the 3 sessions. First session, we will presentation about the global perspective and challenge of social protection. The second session, we will presentation for the experience and alternative or country initiative, and this and third session we will debate and discussion. We have 3 moderator. The first is Mrs. Tuha. Hello, Mrs. Tuha. This is from IMRC.
Yeah.
And the second, we have the Mr. Yanu Endar Prastyo from BRIN, Jamesta Coalition Indonesia. Hello, Mr. Yanu.
Hello, Mas Sastro and everyone.
Thank you for coming. And this we have the moderator, Professor Rene of Rene from University of Philippines. Hello, Mr. Rene.
Okay, Brother Sastro.
Thank you for coming. Once again, thank you and welcome to our webinar. Thank you for all speaker, moderator, and participant. Before going to the first session, we have a recall of the result from the webinar first and second. I will invite Ms. Tin from CDI Vietnam. Please, Ms. Tin. Hello, Ms. Tin.
Okay. Good afternoon, everyone. For the last 2 days, we have discussed many interesting topics regarding the social protection, the challenges highlighted by the COVID-19 pandemic. And in the webinar too, we have discussed about the financing gaps. So I will share with you some key findings from the first 2 webinars. Hope that you can see my screen.
Yes, we
Is
can.
that clear? You can see my screen now?
Yeah, please.
In the webinar 1, we have discussed about the challenges highlighted by the COVID-19 crisis and the need for adaptation. And we have the update from 4 countries in the region, and all update from our colleagues from Vietnam, Indonesia, Thailand, and Philippines and Cambodia also confirm and deepen the impact and common issue highlighted by the COVID-19, like the serious and increasing case of COVID-19 across the region, the impact on livelihood, income, and working condition, the impact on health, education, mental stress, and violence against women and children. Also, we see the unequal limited act and the late in disbursement of the benefits of the relief package to affected people, especially vulnerable people. And also we see the increase in cultural costs across the region, the simplified admin procedure, and the reach out more people, but the amount of benefits is still small in comparison with the GDP. Through the discussion, speakers also propose some specific recommendations, like the government needs to be flexible for spending assistance fund, certain timeline for distribution of the benefits, ensuring leave compensation benefits, free COVID testing or vaccination are also digital transformation to add the further admin procedure and support. We also, the speaker also highlights the key important thing regarding public oversight monitoring, like promoting community roles in ensuring effectiveness of social protection program. And also, speaker raised the concern about the mental health and psychological counseling to workers and others affected by the COVID-19. During the discussion, many questions have raised concerning the COVID-19 impact and the need for adaptation. A lot of questions have been raised by participants, like how to advocate government for more responsive action toward workers and people, how to make recovery program happen, more specific demand for social protection to cover more vulnerable groups. Yeah, and also the discussion highlights the need for alternatives in social protection system throughout the region. Yeah. And in webinar 2, we discussed specifically is the financing gap of social protection in response to the COVID-19. The update from different countries, from Indonesia, from Vietnam, Laos, Malaysia, and Thailand, has confirmed the gap in financing social protection. The crisis has provided a wake-up call to the significant gap in coverage and adequacy of existing social protection policies. Almost all of social protection programs are basically coming from the existing program, and overall approach is also confusion and poorly addressing the problem of the poor. That means the under-preparedness by the government from many countries in the region. And we see the similarity among countries is the reason. For example, the government inability during the pandemic to encourage the transformation of state revenue sourcing to improve social protection program. Every government has not mobilized enough resources to increase the state revenue and increase the budget for financing social protection programs to reach all new vulnerable groups due to the COVID-19 pandemic. Oh, I cannot move on. Yeah, and we received many insightful discussion during the plenary discussion and Q&A. We highlight the university and inequality of benefits. Like the current social protection is far from universality. Inequalities among different kinds of workers, both in terms of benefits and contribution fees. Regarding financing for social protection, we highlight the need for budget transparency and also some solutions to set for fiscal space for social protection, like reduce government expenditure, increase revenues, introduce some kinds of tax, especially tax on poverty of the wealth tax or other sorts of budget to be considered. For example, the international debt. Key concern also raised about the targeting inclusion error. Those who are actually eligible and those who are not to be the beneficiary. The definition of poverty is not the problem, but ignore the problem of flexible market, labor market and informalization, and also targeting a measure to identify informal worker needs is also the problem. And we also come up with common action among countries in the region, like the solidarity. We think that it is a form of cooperation between different stakeholders in the region. And also the proposal on taxing the rich should be considered deeply in the agenda of the region. So it's very interesting to see these problems, see this issue. And I hope that in today's discussion, we will dig more into the problem and also hear from the speaker to get the solution for a transformative social protection. Yeah, thank you.
Thank you, Dean. I think for the next is the floor is please Mrs. Tuha to moderate the session 1. Thank you. Hello. Hello, Mrs. Tuha.
Oh, sorry. Sorry, I'm unmute. Okay. Hi, everyone. So now we will start the section, the first section of the speaker discussion. We have the global debate, rethinking on social protection, and we have a speaker from ILO Oxfam, global social justice and development pathway. So maybe I just quickly introduce the speaker. We have Dr. Francine Metrum. She has a PhD in social science and work as an European institution and several Belgian universities. And she's the author of several books on development, poverty, inequality, and social commons. She also the founder of the Global Network of Global Social Justice and coordinator of the AEPF Social Justice Cluster. We have Mr. Nguyễn Hải Đạt. She's from ILO Vietnam. He has more than 20 years of experience working in development, especially in social protection. He also Secretariat member of the UN Inclusive Growth and Social Protection Working Group in Vietnam. We have Hinde van Raymond Rizenmoto. She's a social protection policy officer of Oxfam Belgium and coordinator of the social protection policy team in Oxfam International, a worldwide confederation of 20 affiliates and working with local partners in over 70 countries to fight poverty and inequality. Hinde is also a co-author of Oxfam recent report on social protection as an adequate response to the impact of the COVID-19 crisis on people income. And the last person, the last speaker in the first channel is Dr. Stephen Keats. He's a principal social protection specialist at Development Pathway, and he has worked across more than 30 countries, including Southeast Asia. He has a wide range of experience across many aspects of social protection, has successfully supported national policy development in a range of countries and undertake research on a wide range of topics. So now I would like to invite Dr. Francine Metrum. In 10 minutes, please provide an overview of different approaches to universal basic income and your hobby in this issue. Please, Dr. Francine.
Thank you. Thank you very much. Can someone do the screen sharing?
Yeah, Yuri, please. So, Yuri, please show presentation of Dr. Francine.
Yes, but I was wondering if you have the slides, if you can do the screen sharing. Otherwise, I have to look for it.
Another fire.
This point is I am in Mexico, and here it is 2 a.m. in the middle of the night.